Everybody. Thanks for joining us, and we're happy that you're able to take time aside from your work schedule to join in on the ongoing discussion on how to reclaim and secure a healthy environment. So Healthy Space series serves to promote the ongoing conversation on what lies ahead in our future environment, as well as what are the challenges that we're eager to assess and solve. So this applies to all, such as, for instance, employees that are transitioning back into the workplace, as well as those who are furloughed, let go, and looking for their next opportunity and workplace that would secure their well-being, as well as feed into their passions. So these conversations are here to help you to obtain methods in finding healthy environments in your workplace and home setting. And before I introduce our guest speaker, I wanted to explain the format of these presentations. Usually we start with our guest speaker's presentation, followed with a Q&A. And with the Q&A, we advise everybody prior to the webinar to submit any questions to our Eventbrite organizer. But if you have any questions that come up during the presentation, we're happy and welcome you to type in your questions in the chat setting. Because this presentation is recorded, please be mindful when placing in your questions in the chat room. All right, so let's get started. I'm happy and honored to introduce our guest speaker, Sara Karerat. So Sara Karerat is the Director of Applied Research at the Center for Active Design, where she leads the organization's translation of public health research into actionable solutions that optimize the built environment for health, both domestically and internationally. Sara previously worked as a communications associate with the Partnership for a Healthier America, where she developed strategic campaigns to motivate healthy behavior change among target populations. Sara holds a Master's of Public Health from Columbia University and a Bachelor's of Arts from Hamilton College, where she majored in public policy. Everybody, let's give a warm welcome for Sara.
Thanks, Irene, for that introduction and for inviting me today to share more about what the Center for Active Design, what our organization does, and what our role in the fight against COVID-19 looks like. Today, I'm going to discuss how we can leverage the built environment and create more resilient communities in the midst of COVID-19 and beyond that. So as I move forward, you guys should all be able to see my slides. I'm going to pause my video just to avoid the distraction there, but we'll turn it back on during the Q&A so it can be more of a one-on-one conversation there. So I want to start with a brief look at the long history of how adjustments to the built environment have successfully reduced transmission of infectious disease. In the 1800s, the majority of New York's population was dying from infectious disease. To address this, New York City really looked at a wide set of design and policy interventions. On the design side, the city created the park system, developing Central Park for all of those in New York City without access to private outdoor space. Specifically, one of the most notable outdoor spaces created during this time was Central Park, which was defined as the working man's lung, really giving increased access to outdoor space necessary to fulfill a healthy life. The city also created the Croton Aqueduct and the reservoir system as a way to bring fresh water down to NYC residents. On the policy side, New York City was one of the first to set design strategies for housing through the Tenement House Act, which set minimum standards for light and air ventilation within residential properties. In addition, in the late 1800s, the city created the sanitation department to maintain public spaces and keep the streetscape clean. New York City was so successful in their efforts to reduce infectious disease that by 1940, which was well before the widespread use of antibiotics, rates of infectious disease had drastically dropped, accounting for just 11% of deaths in the city. So here on this slide, you see that in the 1800s, the infectious diseases were the cause of 57% of all deaths in New York City, and that number did drop to 11% by 1940. Long story short, our understanding of how the built environment can impact disease transmission is not new, and it's only continued to expand since the days of the Industrial Revolution. Now, just to give you a brief introduction to the Center for Active Design and our role in this conversation about the built environment and COVID-19, Our organization is committed to translating complex public health research into actionable solutions for the real estate industry. We have spent the past decade advising communities, corporations, and jurisdictions on how they can ensure that health is a priority within the investment, design, and development of their real estate portfolios. Now, as the operator of the Fitwel certification system, we provide a compendium of science-based tools and resources for a variety of property types. The scorecards we provide apply to office properties, retail developments, multifamily residential buildings, as well as commercial and residential sites. With the spread of COVID-19, we have seen a heightened interest in our mission of building health for all. We have seen a massive uptick in interest from our community to understand what can be done within buildings to mitigate both acute and long-term health risks. Based on this, we have continued to do what we do best, translating the public health literature into next steps for the real estate industry to help guide their efforts to mitigate transmission of viral disease and promote long-term holistic health. As part of this effort, we have published 5 chapters that make up our Research to Action, Building Health for All in the Face of COVID-19 series. You can see the topics of each of the chapters outlined on this slide. While we normally wouldn't push out resources in a piecemeal format like this, given the questions that we have been receiving and recognizing that many companies and organizations are currently developing and refining pandemic response plans and tenant reintegration plans, or even beginning to welcome tenants back into office spaces, with New York City beginning to reopen its offices as of today, we wanted to provide insights and responses to the questions we have been receiving as quickly as possible. The chapters we have developed are based on the review of relevant literature, including emerging research on COVID-19, as well as learnings from other viral epidemics and pandemics, such as SARS, MERS, and influenza. We also make sure to stay in regular conversation with our partners at the CDC, who have helped guide our framing and point us in the right direction towards new and relevant findings related to the unique aspects of COVID-19. As we all know and have seen, the research around COVID-19 is continuing to emerge and shift as we move forward, so having this relationship has really helped us stay on top of all of the emerging findings. Today, I'm going to focus on the first 3 chapters of this resource. Chapter 1 focuses on what we know to date regarding how buildings can be leveraged to mitigate viral transmission. In Chapter 2, we move on to discuss evidence-based strategies to help building owners foster trust among tenants. And this ability to build trust ultimately has a profound impact on employee mental health and productivity. We've seen building trust as a vital aspect of re-engaging workforces and making folks feel secure in returning to the offices. Chapter 3 speaks to how residential building owners can support mental health of residents, which is especially important with so many of us now spending more time in our homes than ever before. Meanwhile, Chapter 4 focuses on how dense urban areas can be optimized for people. This specific chapter was developed in response to many of the articles that have come out recently, which have taken a bit of a negative slant on density. In this chapter, we refocus the conversation on how density can support long-term and short-term public health goals. And finally, Chapter 5, which was released just last week, focuses on the role equity and health disparities have played in COVID outcomes and how the built environment can be reimagined and optimized to ensure all people have access to health-promoting environments. As mentioned, in the interest of time, today we'll be focusing on chapters 1, 2, and 3, but for more information on all of the chapters, you can visit fitwel.org/COVID-19. Now to dig into the first chapter of our COVID-19 resource, which focuses on how we can leverage buildings to mitigate viral transmission. This chapter highlights immediate, actionable, evidence-based solutions for addressing viral transmission within buildings, both commercial and residential. The goal here is really to help guide building owners, facility managers, and employers as they work through either supporting residents in the present or as they plan for an imminent or an eventual or current return to the office, depending on where they are located and what phase of reopening they are currently in. As you may know, and as you can see from the graphic here, there are 3 potential sources of COVID-19 transmission. The first is person to person, which occurs through what are known as large respiratory droplets. Droplets carrying the virus can be released when an infected individual, asymptomatic or symptomatic coughs, speaks, sings, sneezes, or breathes hard, for example, in an exercise class. This is currently believed to be the leading cause of transmission. There are a number of strategies that can be applied within the built environment to mitigate person-to-person transmission. The first one is an operational strategy, and that has to do with paid sick leave. As you would expect, when employees feel empowered to stay home when feeling sick, that can make a huge and significant difference when it comes to viral transmission. One study found that providing just 2 days of paid sick leave, specifically for the flu, reduced workplace infections by nearly 40%. Two of the strategies that you have likely been hearing the most about are social distancing, which we like to refer to as physical distancing, and hand washing. Physical distancing is vital when it comes to diminishing risk of viral transmission. Within residential spaces, this can be applied in a number of different ways. Building managers can post signage advising that only people living together in a household should take the elevator together, or that physical distance must be maintained within residential common spaces such as outdoor areas. Within the workplace, staggered work schedules and support of remote work for those who are able will be vital. Hand washing is another strategy that's important for a number of reasons when it comes to reducing person-to-person viral transmission. It may sound absurdly simple, but by washing your hands for 20 seconds regularly, especially after coughing, sneezing, or wiping your nose, you can help prevent the spread of the virus from yourself to someone else. This is true even if you are asymptomatic. As always, it is also important to wash your hands after using the restroom, which research suggests is a surprisingly not common practice. When it comes to the built environment, hand washing signage can be especially impactful when it comes to behavior change. So such a simple intervention as posting signage that guides folks on what the health benefits are can really motivate behavior change. The next form of transmission is surface-to-person transmission. This pathway for transmission occurs when a person touches a surface where large droplets of the virus have landed and then proceeds to touch their mouth, nose, or eyes. As you can see in the image, there are several factors that impact the survival of the virus on a surface, which is also known as a fomite. A fomite is essentially a fancy word for any object where the virus can be carried. It could be a door handle, a sink faucet, a desk, or a countertop. The virus's survival on one of these surfaces depends on several factors. First, it depends on the virus properties, which is something we are still continuing to learn about when it comes to COVID-19. It is also dependent on the properties of the fomite or surface. This is also an area that is continuing to be explored in relation to COVID-19. A study published in the New England Journal of Medicine back in April did begin to explain the different lifespans of the virus depending on the surface. This study found that the COVID virus can remain viable for up to 72 hours on plastics, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. It is very important to note that just because the virus is viable on the surface for that long does not mean that there is enough of the virus to cause an infection. By the end of these time periods, only 0.1% of the starting virus remained alive. Basically, the virus is steadily dying over time, meaning the viral concentration is steadily decreasing. The third factor impacting the lifespan of the virus on a fomite is the surrounding environment. For example, what is the humidity level? Is there UV exposure? Is the fomite outside or inside? The exact impact these elements have on COVID is still TBD, but we are continuing to follow the research as we learn more. When it comes to reducing risk of surface-to-person transmission, the key strategies are regular cleaning, maintaining good hand hygiene, and creating an environment where relative humidity is between 40 and 60%. As you may have heard many times throughout since the beginning of the COVID-19 pandemic, regular disinfection is one of the most evidence-based and concrete ways to reduce risk of surface-to-person transmission. The COVID-19 virus can be deactivated by common disinfectants. It is especially important to target high-touch areas such as tables, doorknobs, light switches, countertops, faucets, sinks, elevator buttons, etc. One interesting tidbit is that a cleaner sink also increases the likelihood of occupants washing their hands. So this is really a win-win. We also wanted to note that no disinfectants are currently Green Seal certified, because none are completely harmless. So we do recommend incorporating guidelines for safe use of these products into cleaning protocols. Within Chapter 1, we have linked to guidance from Green Seal, which provides very thorough information on how to safely use disinfectants, which we recommend you check out. Also, since publishing this chapter, the CDC and EPA have teamed up to release thorough guidance for cleaning and disinfecting public spaces while still maintaining a healthy environment. As for humidity, the reason that it can be leveraged to mitigate transmission is that environments with low humidity are more supportive of viruses. This is especially droplets in the dry air evaporate quickly, reduce in size, and travel further. This means that they are able to reach more people and more surfaces. By ensuring humidity is between 40 and 60%, buildings can help decrease the number of surfaces droplets reach. While we know that humidity is effective at reducing the length of time virus particles remain viable, there are also serious health concerns that must be considered when increasing humidity within a space. This is especially true for older buildings, which oftentimes weren't built or designed to support higher humidity rates. Humidity should be regulated by property managers and building owners, and we do not recommend personal humidifiers within commercial buildings, as they can result in disruption of the overall humidity levels for the building. The third and final type of transmission is aerosol transmission, which is an area we are continuing to learn more about as new research is emerging daily. Aerosol transmission of a virus occurs when small droplets travel further than 1 meter through the air. Long-range airborne transmission is possible when the droplets of infectious material are small enough to remain airborne and be transmitted over long distances. Research on the extent to which COVID-19 can be transmitted via aerosols is inconclusive at this time, but the WHO does recommend taking precautions aimed at mitigating aerosol transmission as we continue to learn and gather more conclusive information about the virus. Recent evidence indicates that aerosol transmission may be possible, especially within highly trafficked and dense areas and overcrowded areas. One study found airborne SARS-CoV-2 viruses in highly trafficked and unventilated spaces, such as patient bathrooms and medical staff areas. In addition, another study found that fitness dance studio classes across 12 sports facilities were connected with 112 infections, 54 of which were among class students. This article argues that the intense spread was likely caused by a mix of factors, some tied to person-to-person transmission and others tied to aerosol transmission. In addition to the large class sizes, the warm atmosphere in the sports facility mixed with turbulent airflow caused by intense physical exercise is known to cause more dense transmission of droplets. All of that said, we realize it is extremely important to balance. I need to go back to the strategies. In addition to the strategies that can mitigate person-to-person transmission, aerosol transmission can be mitigated through ventilation and filtration practices. Higher ventilation rates have been shown to be associated with decreased viral transmission. Bringing in more outdoor air into the indoors has a strong potential of reducing aerosol transmission. All of that said, we do realize that it is extremely important to balance sustainability concerns with those relating to disease spread, as climate change has a long-lasting impact on population health. Recent studies suggest that hybrid ventilation strategies that employ a mix of natural and mechanical ventilation may be the best approach to balance these two priorities. Air filtration is another effective approach to mitigate viral transmission and promote high-quality indoor air. One study found that the use of MERV-13 filters were associated with a 31% to 47% lower transmission rate than a similar space without any filtration. As you may know, MERV-13 filters tend to trap less than 7% of air particles that are between 0.03 and 1 microns. Meanwhile, MERV-16 filters can trap 95% or more. And I'm so sorry, I misspoke. MERV-13 filters can actually trap 70% of air particles rather than simply 7. In addition, air filtration is impactful when it comes to improving indoor air quality and reducing exposure to particulate matter. This is especially important given that long-term exposure to particulate matter has been associated with increased risk of mortality among COVID-19 patients. This means that these efforts will likely support health in both the short term and long term. Just to wrap up our conversation on chapter 1, which I promise is the most technical of the chapters at this point, I wanted to show a quick example of hand washing signage implemented by one of our partners, Tishman Speyer, within their properties. A simple message like the one seen here can go a long way. Prior to COVID-19, only about 40% of Fitwel users implemented the hand washing signage strategy. We expect that to change significantly among newly certified projects as we receive increased attention to strategies demonstrated to motivate behavior change and reduce viral transmission. Now moving on to chapter 2. Businesses the world over are grappling with how to ensure their employees' safety and perceptions of safety once they are able to return to the workplace. This chapter digs into how commercial building owners can build trust among tenants and employees. This is especially important given that even before COVID-19, 66% of the global population did not have confidence in leaders, including CEOs. Now, more than ever, workplaces must practice transparency to build trust and support employee mental health. This means that clear communication is vital. Many building owners and employers are taking significant steps to support employee wellness in response to COVID-19. But if none of the employees are aware of the efforts being made, then the full impact of these strategies will not be realized. Communication should be transmitted through a variety of mediums, such as newsletters, webinars, and signage, to ensure the messaging reaches all tenants and employees. It is also important to ensure that tenants have an opportunity to offer feedback. Providing this opportunity can empower occupants and motivate them to act upon the feedback received. By acting upon the feedback that is provided, tenants will begin to feel heard. Post-occupant evaluations, which can involve everything from surveys to interviews to town halls, have been shown to increase employee confidence in normal times, and we anticipate that those impacts will only become greater in the wake and midst of COVID-19. These methods can also help shed light on concerns that building owners and managers may not have previously considered. As you may imagine, the implementation of rigorous cleaning practices will also be vital when it comes to not only reducing viral transmission, but also promoting trust. Through cleaning practices, we're able to reduce signs of disorder. Research conducted as a part of CFAD's Assembly Initiative, analyzing relationships between the built environment and civic trust, demonstrate that signs of disorder are associated with diminished trust in authority figures and fellow community members. As you can see in the graphic shown here, having poorly maintained greenery in a neighborhood was worse for community trust than having no greenery at all. While this research was conducted in public spaces, similar learnings can be applied to a workplace setting. Rigorous cleaning practices have been identified as a key strategy for mitigating risk of viral transmission, and as such, is going to be an area that occupants are hyper-focused on when returning to the workplace. In the wake of the SARS outbreak in 2003, studies reported that cleaning tactics helped contribute to the culture of safety at work that helped employees feel more confident as they re-entered the workplace. Another tactic that has emerged as highly impactful is the implementation of a pandemic preparedness plan, which can be integrated into a broader emergency preparedness plan. Although each workplace will have a unique set of needs depending on location and context, many commercial office buildings will encounter similar concerns when it comes to both ensuring occupant safety as well as strengthening perceptions of security. Based on the available evidence, the key to a successful pandemic preparedness plan seemed to include involving all key stakeholders, establishing common goals, and practicing clear communication. When it comes to commercial spaces, a successful pandemic preparedness plan requires collaboration between owners and tenants, as each group will have unique responsibility when it comes to implementation. I also just want to quickly touch on one area where you've been getting a lot of questions, which is about whether fever screening can build occupant confidence. While we completely understand the goal of fever screening, the research indicates that on its own, this tactic will ultimately miss a significant portion of the population infected with COVID-19. This is in part because a significant portion of those infected are either pre-symptomatic or fully asymptomatic. While temperature checks could be one part of a screening procedure, a more comprehensive screening process that includes questions like, have you been in contact with anyone diagnosed with COVID-19 over the past 14 days, will be more impactful. Also, if screening processes are implemented, they should be accompanied by clear instructions of what employees should do if they aren't able to come into the office. For example, whoever is conducting the screening process should have a list of where individuals who screen positive can get tested for COVID and instructions on precautions they should take for the next 14 days. Screening for COVID-19 will only benefit occupant trust if it is effective, and the concern with just using fever screening is that it could give occupants a false sense of security and ultimately degrade trust in the long term. I want to end my presentation today by quickly going over some of the key findings from Chapter 3, which is focused on how residential buildings can promote resident mental health and well-being now and into the future. Even before the rise of COVID-19, mental health outcomes were already a leading global health concern. The World Health Organization has recognized depression as the leading contributor to global disability. Meanwhile, anxiety is the 6th leading contributor. As you can see on the slide here, approximately 18.1% of adults in the United States suffer from a mental illness each year, with 4.3% struggling with a debilitating mental illness. What early data is showing us is that the onslaught of COVID-19 could exacerbate mental health outcomes. The graph on the other side of the slide shows findings from a Kaiser Family Foundation survey tracking how COVID-19 has impacted mental health of those living in the United States. While in early March, 32% of respondents reported that worry and stress related to the coronavirus outbreak has had a negative impact on their mental health. By late April, that number had increased to 56%, demonstrating the steadily intensifying impact COVID-19 has had on our mental health. So what can the built environment do to benefit mental health in a time of such severe uncertainty? With so many of us spending more time within our homes and neighborhoods than ever before, the design and maintenance of these environments is more important now than ever. Within the home environment, strategies such as integrating greenery, providing access to outdoor spaces, improving sleeping environments, enhancing indoor air quality, as well as offering on-site health promotion programming and supportive services, all have a tangible impact on resident mental health. Today, I want to focus on the unique impact of increasing access to greenery within residential environments, since the research behind the benefits of greenery is so long-standing and continuing to expand. Greenery has long been viewed as therapeutic, and an ever-growing body of research supports that understanding. Access to nature is associated with a range of positive mental health outcomes, including but not limited to stress reduction, diminished anxiety, and a lower prevalence of depression. In today's world, where more than half of the population now lives in urban environments, creating innovative strategies to enhance human connection with nature is vital. This connection has only become more important in light of the mental health impacts associated with COVID-19. The evidence indicates that simple interventions such as increasing vegetation cover can contribute to improved mental health across the population. Residential greening activities can include everything from integrating trees, shrubs, and other foliage in the area surrounding a building to creating an on-site community garden or restorative courtyard. The impacts of residential greenery are especially profound when mixed with physical activity, which is one reason that gardening has been found to be so beneficial when it comes to mental health. Gardening is associated with a whole host of positive health outcomes, including reductions in depression and anxiety symptoms, stress, and mood disturbance. Gardening has a long history of being used for therapeutic purposes, and the research on its benefits has expanded considerably over the past several decades. Evidence suggests that gardening can have a uniquely restorative effect. The graph here depicts results from one study which found that following a stressful experience, 30 minutes of gardening successfully returned levels of salivary cortisol, which is a common indicator of stress, to baseline levels. This means that just 30 minutes of gardening can have a significant impact on mental health and stress recovery. Residential buildings have an opportunity to increase access to gardening by prioritizing within their spaces. When that isn't possible, integrating greenery as much as possible in the building and the surrounding area is another impactful tactic. As I mentioned at the start of this presentation, CFAD is the operator of Fitwel, which is the leading building certification system designed to optimize health. All of the areas touched on today are featured in our scorecard, which you can find at fitwel.org. I have identified the strategies that touch on the tactics outlined in chapters 1 and 2 of the Research to Action resource here. And on this slide, I have outlined the list of strategies from the multifamily residential scorecard that directly impact mental health outcomes. And now I am going to pass it back to Aireen for a little bit of time for Q&A.
Okay. Thank you, Sara, for taking time aside from your busy schedule and showing us such an informative presentation. So before we start with the Q&A, I just wanted to give everybody a few moments just to type in any questions that they had for our guest speaker in the chat setting. For the time being, while people are inputting any questions, I have a few questions that we could start off with, if that's okay, Sara?
Yeah, go for it.
Okay. So let me just like scroll down right here. I would think that Fitwel it's very commendable that you're spearheading and leveraging building design to address the physical, mental, and social aspects of health in a spectrum of contexts such as residential, office setting, and trust in the workplace. Thanks for sharing that. What would you say would be the first step for us to digest the information and to practice the recommendations that you provided?
Yeah, definitely. That's a great question. So what we try to do with Fitwel is really provide actionable steps that can be taken within buildings, depending on whatever the context you're working with. So for example, if you are a developer or architect working within a commercial space, then I would recommend you taking a look at our commercial scorecards because that really does outline all of the different strategies that can be implemented within the workplace to promote and optimize health from a variety of perspectives. So in its formation, Fitwel was really, really focused on chronic disease and chronic conditions. But in light of COVID-19, we've really shown how the scorecards already impact infectious disease, but also how those strategies can be optimized to ensure that we're meeting the current needs of building owners as folks re-enter the spaces. So my first recommendation would be head to fitwel.org and download the scorecards because that really does lay out all of the different strategies that can be implemented within the different spaces.
Oh, that's great. And then thank you for sharing the link. So as a reminder, everybody, that we're gonna send a video link of this recording so that way you have availability to the resources that Sara was able to share. So for the next question, I would think that I thought was a highlight was trust at the workplace or trust in your residential setting. So as mentioned, 66% is a large portion of occupants who trust in their built environment. So a previous discussion from another panel, like such as ULI Europe, they reflected that buildings and building owners will face liability of protecting building occupants. So how can buildings or building managers gain or regain occupants' trust? And what are the challenges that lie ahead in gaining that trust?
Yeah, definitely. So that's a great question. And I'm not a lawyer, so I'm not going to get into the liability pieces of it. But as far as the health aspects of building trust within folks who are coming into your spaces every day, communication is really going to be key. So building owners and managers really need to be sharing with their occupants what they're doing in order to ensure safety. And those recommendations really do need to be based in the evidence, because if ever there's questioning as to why they're implementing something, there needs to be a rationale. It can't just be, oh, well, we saw that X, Y, and Z was doing social distancing, so we wanted to do it. It needs to be because this is going to promote health and this is going to help ensure that there is a sustainable way to welcome you back into our spaces. And another thing I would say, and this specifically gets at fever screening, is making sure that folks in the building do have a pathway that if they're diagnosed with COVID, they know what to do. So they know that they need to tell the building manager and property manager that they were diagnosed. so that that information can also be transparent and be shared with the occupants, so that there isn't any question of, oh, I haven't heard anything about somebody being diagnosed with COVID, so nobody was, when maybe somebody was and that information just hadn't been shared. So it's really going to be about communication sharing and looking to the evidence.
I see. And that's interesting. You mentioned about communications, and it was also mentioned about signage. And I was wondering, in terms of like, what would be the effects on behavioral measures? Like, what would it be universal, and would it translate to preceding cultural behaviors from different backgrounds? And I'm curious about that, and how it would be enforced.
Yeah, so what's great is we know that from a public health perspective that signage works. So we've seen it with stair signage, encouraging people to use the stairs, placing that at elevator call areas. People want to do what you're telling them to do, and they want to know what they should be doing to promote their health. So, and especially in this case where the fear is kind of acute, and there is kind of a need for that communication. So signage, for example, encouraging mask wearing, signage encouraging only a few people in the elevator at a time. So things that people might not think of as they're re-entering these spaces, where a lot of people will kind of go back into autopilot of how they used to behave in those spaces, just because that's human nature. It'll be important to have the signage there as sort of a reminder of what the new policies are, and really kind of speaking to the desire of how this is a community approach. So mask wearing is only as effective as if most of the community is wearing them. So kind of leveraging that and explaining that through signage will be very important as we kind of move back into these spaces. And it'll be important for setting expectations. So in addition to signage, all of that information should be sent to occupants ahead of re-entering the space, so that they come in understanding what that kind of social contract will be.
I see. So in terms of, you mentioned in terms of like people that started activities that include such as gardening or anything in terms of landscape involved in their activities, would it be suggested that building design as well as landscape design, or in terms of development, would now heavily rely on landscaping as well in terms of promoting a secure, healthy environment?
Yeah, so the benefits of greenery and integrating that landscaping perspective within the built environment is so profound from both a sustainability perspective and a human health perspective. So from a sustainability perspective, having greenery and integrating that into urban environments has a huge impact on heat island effects. So can lower temperatures, can have a significant impact when it comes to climate change. And then from a health perspective, not only does that impact health, but also the mental health perspective. Right now, the only activity that a lot of people can do, and especially when we were all sheltering in place, was go outside for exercise or go outside to get some fresh air. And that has become so much more, the benefit of those spaces has become so much more apparent, specifically in urban areas, because of just the lack of other activities. Public space and outdoor space is the safest thing to be doing right now, because within an outdoor space, it is, the transmission of the virus is going to be mitigated just by the natural kind of aspects of the outdoor area, such as fresh air and sunshine. Also, we've noticed and seen that green space and outdoor space is distributed in urban areas in a very inequitable way. So addressing that inequity and disparity will help ultimately to address these disparities in mental health outcomes and also physical health outcomes, with green space also encouraging physical activity. So the impacts are definitely super multifaceted.
I see. And I remember it was mentioned way back in the beginning of the presentation. I thought it was interesting that given that the cities many cities, as an example, their infrastructure resulted from the need to improve the living environment and addressing health issues. How should we look towards the past for answers in addressing COVID-19? Like maybe find answers in examples that were briefly discussed.
Yeah, definitely. So one of those is outdoor space. So leveraging outdoor areas for physical activity, for restorative benefits that outdoor space provides is something we learned during the time of mass tuberculosis and cholera. One other interesting question that we've been getting a lot is about reopening of buildings. So aspects like water quality and air quality and how those can impact people, how a stagnant building, the different areas that need to be addressed as we reopen. And a lot of those are super similar to kind of the very base level aspects that were included in the Tenement Housing Act. So making sure that systems are flushed out so that water quality isn't impacted by Legionella and other bacterial conditions, and also with HVAC systems, making sure that they are also tested and running properly, given how long some of our buildings have been left stagnant. So a lot of these things are well known and well understood. It's just applying them in a very systematic way across the board to make sure that it's reaching everybody.
I see. I completely understand about that. And I think we have a question that trickled in from Dr. Octavio Sousa. And it says right here, I'm wondering, doctor, if you could also, if you would like to speak up about your question, or if you would be okay if I would say it as well. There we go.
Yeah, good afternoon.
Hi.
Hi, good afternoon. Excellent presentation, Sara. Thank you, NorCal. I've been listening and I've been exposed, although not just in our country, but the whole world, the word construction or the word building for physical distancing as synonymous of social distancing, and it is not the same. Actually, there's a very delicate line between racism and social distancing. We don't want social distancing. We want physical distancing in terms of science and health, but we need this physical distancing. And I want to know if you have any consideration about this, and also about the human need of being able to understand that this is a temporary stuff, like a temporary condition, and we should not state it as a normal condition. We should look forward to create spaces that promote the total contrary, what is I have been seeing, even though in the BBC, I don't know if you have seen those bubbles for exercising for each other, the spacing that are separated in gyms, they're not what we should look as normal.
Yeah, no, this is a great question. So that is exactly why we try to reference the distancing as a physical distancing, because that's really what it is. And it's for this period that we're in now, which again is why communication is so necessary, because there's so much uncertainty right now. And by kind of continuing that uncertainty and not stressing that this isn't always, and that there are also that long-term health needs to be considered, because all of the dire health consequences that are being experienced by those with comorbidities are profound. So if you have kind of restrictions on physical activity, then that is going to result in higher levels of obesity, which is going to result in more death from COVID. So it's obviously that's not like a direct cause effect, but that said, we do need to be focusing on holistic health, long-term health, how we can support communities in this time through the built environment, but also how we can prioritize health moving forward. This isn't like just a moment in time, and that health is always important. and we need to be looking at it with that long-term view. So I really appreciate that question.
Thank you.
Mm-hmm.
Okay, Doctor, thank you for the question. I have one question left for Sara. I'm curious in terms of what is the future outlook for Fitwel in terms of already you have these efforts that started prior to COVID-19 and other illnesses that we're just more of addressing, but what is the outlook from here on?
Yeah, so Fitwel,
if you're able to disclose it.
Yeah, no, that's a great question. So Fitwel is continuing our work to prioritize health within the built environment. We recently launched our commercial site and community site scorecards to move past just the building, but also into the neighborhood context, into workplace, office, campuses, to kind of expand how those strategies could be applied. We are currently focused on how we can meet the growing demand for COVID resources and how we can continue in a time when the science is continuing to evolve so rapidly, make sure that that's integrated into our products. So that is what we're working on now, but we are continuing to consult and work with partners within this space, talking to folks at the CDC to make sure that we are integrating the best science possible into our products.
I see. And I think it was interesting point to bring up where we've identified, and I think a lot of people in general have identified that social distancing doesn't automatically mean social distancing. It's just more physical distancing. And that term started in the beginning, but now we're hoping to reframe it moving forward. And I wanted to call out to any attendees for any questions, last minute questions prior for us to conclude this Zoom webinar. All right. So if Sara, if we could, again, I'd like to thank you for all the efforts and that Fitwel has been addressing, and I'm looking forward to learn more from Fitwel as from what the work that you do. And I'm hoping to just look over the presentation as well, just to make sure that it's embedded in myself. And I hope the attendees find value in that. And I wanted to move forward to our slide, just to, if anyone that would be interested on upcoming events that Columbia and NorCal Alumni has organized. So this coming Wednesday, we have Network and Grow Your Business with Golden Seeds and Hello Alice, which is a network with investors and entrepreneurs in small groups. You can learn more about angel VC investing and grow your business with Hello Alice. And then next Monday, we have Core Power Yoga Sculpt. And following in next July, we have the imagery meditation. So you can take a mini vacation to the beach with this guided imagery meditation led by one of our co-directors and the alumni group. So with that, I wanted to conclude and say thank you, Sara, and thank you for all the attendees that attended. And we hope that you found this information very informative and useful. And as part of the Healthy Space series and this ongoing conversation, please provide your feedback. We're going to provide a follow-up email with the link, and we're happy to continue this conversation as we have further developments of COVID as well as our surroundings and just in the context of itself. So with that in mind, I want to thank everybody for attending. Until next time, I would like to say stay safe, healthy, and well, and have a great day.
Thank you.